he hurts me, but he's my dad. I can't cut him out of my life because he's my dad. Well,
Yeah.
you can love someone, and at the same time, this someone might also be hurting you. So you might as well just take a step back and love them
From a distance.
yeah.
You're listening to a show for those who aren't afraid to admit that they don't know what the hell is going on. This is a safe space to ask any question you may have in order to keep learning and growing every day. Because the truth is, there's no way to know everything. So join me as I talk to people who know a little something about life. But there's a catch. I'll also know nothing about the questions I'm going to ask. Just like in school when there was a suggestion box that the teacher would read out loud, I'll be pulling up the questions without ever seeing them beforehand. Let's just say this should get very interesting. This is Trust Me, I Know Nothing. Wait, what? Hey, welcome to another episode of Trust Me, I Know Nothing. On our last episode, things got a little emotional as we discussed my journey with mental health and therapy and some of the things that I've struggled with. But something really cool happened after that episode aired because a lot of people started to reach out to me saying that they've struggled with the same kind of things that I have and how they related with some of the things that I've said. And some people even asked for advice on how to find a therapist because they wanted to ask for help, but they didn't even know where to begin. So I decided to ask my sister, Sara, for some advice in this. Why would I ask my sister about this, you may ask? Well, it's pretty easy. My sister is a cognitive behavioral therapist with almost 10 years of experience. And throughout her career, I've seen how she's treated all kinds of mental disorders and helped a lot of people with their mental health. So when I decided to talk about the misconceptions around therapy and just ask about tips on how to start your therapy journey, I knew she would be the right person to talk to. So join us as we talk all things therapy. Are you ready? Hey, Sarah, thank you so much for joining me today. I have a lot of questions about therapy and therapists, and I figured I could ask my sister about it. So let's start talking.
Okay, thank you very much for having me.
So we've asked our community for some questions, and we got a lot of them. So let's just jump right into it. The very first question is, should everyone talk to a therapist?
But yeah, I think that everyone should have some kind of guide. There are many kinds of therapy, but I think that if you can achieve thinking and interpreting reality in a way that does not make you suffer, it could be priceless.
You don't need to be extremely sick or just suffering. It could help you even if you're not in those like extreme cases, right?
Exactly. So I really think that having a guide could be really helpful for everyone.
Perfect. Now, the other side of this question is, after you've been in therapy for a really long time, how do you know when someone is ready to just stop therapy?
If it's something clinical, when there are no longer symptoms, or when you can space the therapy sessions and the person is still feels safe,
Okay.
it might be time to just like put a pause on therapy and see how they're doing without it.
Okay. And after this pause, is there a certain amount of time wherein you can determine if the person is okay without the therapy or if they should go back? Or is it something that some patients go 6 months and they need it again, and then or maybe some go 6 years and then they need it again?
Exactly. It depends on the person, but I do cognitive behavioral therapy, and the main idea is the patients the tools that they would need on the near future or at the far future, so they can learn how to manage their own lives without the help of someone else, well, of a therapist in this case. But if they're feeling like a little bit lost, they can always come back, or they could like look for some other therapies just like to get a refresh.
Okay. Okay. Yeah, that's good advice actually to check in. Let's see another question from our community. They are asking, what is the best single piece of advice you have been given or you can give someone in therapy?
Well, I would say not to react to high emotions, but to wait and allow the emotion to go down, and then react to it.
Okay, so sort of like assess the situation once the high emotion has come down.
Correct.
Cool. Yeah, I need to work on that. I mean, you know me, I'm always very reactive. So yeah, that's good advice actually, to just let things cool down, cool off a little bit. Okay, another question. Have you ever faced a case where you couldn't help the patient?
We have to understand that each therapeutic structure has its limits, and it depends on the pathology and in the chronicity of the pathology. But sometimes the structure of the therapy falls short. So we need to be like really responsible and aware of how much can we help that person. And if we're not able to do it, be responsible and refer it to someone else.
Okay. So just know your limits. And how do you know, like, I know actually my question is, how do you make sure that your ego doesn't come into play in those cases, and it's like to recognize that it's something beyond what you can do?
Yeah, this is a very important question because it plays with our ego, but that's why we need to be responsible, because we're dealing with people's lives.
Okay.
And not because I'm able to it, not because the structure of the therapy falls short does necessarily mean that I'm not able to help them. I don't know if I'm making any sense, but it's not me necessarily. It might be just the structure of the therapy.
Okay, so they might need just another type of therapy that you are
Correct.
not trained in.
For example, in a girl with anorexia that weighs 20 kilos, the ambulatory model might fall short. So she might need to be checking into a facility, and I can't provide her that. So I won't be able to help her. It doesn't necessarily mean that I'm not good at it, but I don't have the tools to help her.
Okay, yeah. So it's just putting the patient's needs first.
Exactly.
Before your ego.
Correct.
Okay, let's go to another question. Do you have a favorite patient?
Of course, because in the end, well, we're humans, right? And we have emotions. So, of course, we all have favorite patients. The therapist that tells you otherwise is lying to you.
Yeah.
It doesn't necessarily mean that some patients are better or worse, than others. It just means that you make a better click with some.
Okay.
In life, we all have favorite, like our favorite people, because we click more. Like, for example, our favorite teacher or our favorite student or our favorite customer, whatever.
Yes.
And yeah, so understanding that we are humans, yeah, of course we have favorite patients.
I've always wondered if I'm my therapist's favorite patient.
You'll never know.
I should be. I make her laugh a lot. She's always laughing. And she says, I love our sessions. You make me laugh a lot. Like, I'm like, you might as well pay me if I'm entertaining you. But okay, and the other side. So what do you do when you don't like a patient?
Well, it depends, correct? Because if it's something subjective, you just have to pull up with it. But if it's that, for example, the patient is being like mean or aggressive, you should set limits. Well, I usually set some boundaries, and if the patient won't obey them, like won't go with it, I refer them.
Okay, so it's easier. Because if there's no click, then the therapy won't work, right?
but it's just something like subjective. You might as well just like, for example, in my therapy, just go and give this person the tools that they need, and just forget if like it's work, and you
Yeah,
need to, yeah, and you need to be like focused, and the well-being of that person is the most important part that hour. So just make it work.
perfect. Um, and you normally work with adults right now, I know that, but you've also worked with kids in the past. So what would you say is easier for you?
I don't think it's easier or harder. I just think that I do a better job with adults than with kids. I'm not usually good dealing with parents.
Okay.
Yeah, that's something mine and personal that I get like really frustrated, like trying to explain something to a parent, and they wanting you to just cure their kids without making an effort at their home or at their family dynamic. So for me, it's like really frustrating. I rather work with adults,
Okay.
but perhaps if you ask a kid psychologist, he would have another answer.
Okay. Yeah, because if when you see it like that, when you're working with kids, you don't only have one patient, you have the patient and then the parent or parents. So
Correct.
so you are dealing with more than one piece of the puzzle.
Yeah, well, even if you work with adults, because we don't live by ourselves, we are part of a system, and sometimes with adults, you also have to interfere with the wife or with the mom or whatever. But dealing with adults, it's easier for me to work and to negotiate with them.
Okay. 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 This question that came in is something that I've actually wondered for a real long time. Is it true that therapists are a little crazy too?
Well, we are humans, so yeah, but I don't think that we are crazier than the average population. There isn't any studies that prove that, but it can be that therapists might experience something in their childhood and that they decided to use psychology as a personal work tool. And I believe that, well, rational emotional therapies could also be can reduce certain amount of pathology, because they, with the theory and with of their knowledge, they can also not only realize that something's not right with them, but also can be able to apply to themselves these tools.
Yeah. So it's not that they are crazier or anything, it's just that they are a little bit more aware because they have the tools, right?
Yeah,
Okay, well, yeah, I know you can't say yes or no because in therapy everything is subjective.
learning, right.
Okay, so I guess this is a question from someone that goes to therapy because they are asking if it's okay to hide personal information from your therapist because this person feels that there are some topics that are too personal, but at the same time it might be the reason that's causing the mental damage because it's and if it's not treated in therapy, then how can they get better? So what would you say, is it okay to hide personal information?
Well, we always invite the patient to be open as possible. But if they're hiding something, it must be either because of the timing or the bonding. So we have to always respect the timing. And if it's really relevant, at some point it will come out.
Okay.
Okay. And if it's the case that, for example, with adolescents, it happens a lot that they're forced to go to therapy and they won't tell a thing to the therapist. We have to work first of all in the bonding. Okay.
Okay.
So we have to respect the timing. And I've had like different cases. For example, I had a case where after 2 years, a patient finally told me that she was sexually abused, and I could imagine something like that happened to her, because a lot of sense, but I had to respect her timing. And after she did, and after she told me, then we worked on that. But it's really important not to pressure people and respect them.
Okay, that's great. Next question. How many sessions would you recommend are worth trying before deciding if you should stay with a therapist or try a new one?
It's complicated, but I would say that at least give the therapist some sessions, like a pair of sessions of evaluation. And if in those sessions you don't bond with the therapist, you might as well tell him or tell her to refer you to someone else. But at least give the opportunity of some evaluation sessions.
Yeah, well, in my situation when I started going to therapy, because and you're not gonna let me lie on this, something that's very common is as soon as you're being confronted with your problems, you start to reject the process and the therapy. So I would like, I think I was in week 3 or week 4 of therapy, and I started getting confronted by my therapist. And I said, like, oh, I'm okay. I'm all good. I already talked about what I wanted to talk about. I'm done. And all she said was, just give me another month. And if you're not comfortable in another month, then I can refer you to someone else. What do you
That's why
think?
important. I'm sorry. That's why the timing is so important. Perhaps it wasn't the correct time for your therapist. I'm not questioning her work, but perhaps it wasn't the right timing, or perhaps you didn't bond enough for her to make those questions or for her to confront you. And it's never comfortable for us to leave our comfortable zone. So as a therapist, you just have to be like really aware of that. And as a patient, just like make some effort to tolerate it.
There's no magic number of sessions. Like it will really depend on each case, right?
Correct. Yeah.
This is a really cool question that I think a lot of people have. Like they said, if I've never had therapy before, but I clearly need it, how do I choose the right type of therapy for me?
Well, as I said, there are a lot of different kinds of therapy, like coaching and everything. So, in my experience, I would say cognitive behavioral therapy is the most effective in anxiety and mood disorders, because I can tell from firsthand that it really works.
Okay. I guess, I mean, no one asked me personally, but my non medical advice and something that I really like to tell people when they ask me about my therapy journey is when they ask, like, how did I know that this was the right therapist for me? I once heard that when choosing your therapist, you should look at it as if as a new relationship, like if you're looking for a partner. So when you go on a date, you don't necessarily click on the first date. Sometimes you go on a second or third date and see what happens there. And if that doesn't work, you don't give up. You go to the next one and the next one. So it's not about like finding the right type of therapy the first time. It's just not giving up. Am I right?
Correct. And if it helps you to suffer a little bit less, it's working for you.
Exactly. Good. See, good advice. Okay. Next question. Why? Okay. Okay. This seems like a personal question too. Why is it that older people, especially men, view therapy as a bad thing, as if you can't handle the problems in your life on your own? My dad is one of them. This is from someone in our community.
I think this is a multifactorial situation, and that we can debate this for hours and hours, but most of it, I think that the culture has been evolving, and that we are more aware of mental health, and somehow we are not ashamed anymore of telling people that we go to a therapy. It's more common and it's more normalized for us to talk about our emotions than when our parents were younger. So perhaps that's why nowadays it's more accepted to go to therapy than back then. I'm sorry.
Yeah, so it's not that it's I don't think that it has something to do that they're against that. It's just not something that they're used to.
Correct. Yeah.
A-
It's
And
a long topic, but yeah, most of it I think it's because of that.
and do you think that the media has had something to do with the acceptance of therapy? Like we now see a lot more books on it and a lot more acceptance of it in the, for example, a lot of celebrities talk about going to therapy. So would you say that helps making it normal and something that people are more comfortable with?
Yeah, perhaps it is. And now you have contact with people all around the world. So you have a different perspective or a more open perspective than back on the days when where you only like talk to your 5 friends and your 10 members of your family. So yeah, perhaps the media has changed that also.
Cool. See, not everything on social media is bad. So since you started being a therapist, how much of someone's upbringing affects them? How much have you noticed that?
Can be a lot of situations that can be associated both with modeling or parenting. But the importance of this therapy is that it says that nothing in the past necessarily determines the way you are in the present. So
Okay.
something of the past is affecting you in the present. It can always be modified and worked on.
Okay.
At least in this, in the cognitive behavioral therapy.
Okay, yeah, because there are other types of therapy that actually like to dwell on the past, right?
Yeah, like psychoanalysis and like Sigmund Freud. Yeah, but this is a whole kind of different therapy.
Okay. Um, so someone asks, what do you think about sex therapy? I guess these people like what this person likes to watch sex education.
Well, I think that if you have a sexual situation, yeah, I recommend it. But I would go also with like cognitive behavioral therapy because it's like really punctual and you won't have a 5 year therapy for sex inhibition, for example.
Okay.
So just look for some therapy that is like really punctual and go straight to the point. You and your partner can't allow like a 5 year therapy for a problem that it's
Yeah.
affecting on the daily basis.
Yeah, yeah, that's what I was gonna say. You can't wait for 5 years of process to fix something as urgent that's affecting you every day.
Correct.
Okay. As a therapist, you've seen a lot of people that go to therapy that don't necessarily want to be there. So, what would you say is a good strategy, or like what can you say to someone that clearly needs therapy but doesn't necessarily want it, or they're not open to it?
Yeah, well, it depends who that person is. Okay. If it's your friend, you can always suggest therapy because you're like noticing something's not right. But the thing here is that when you're dealing with adults, you can't force anybody to do anything. So you might as well just suggest it. And for example, if it's your partner and it's affecting the family dynamic and he or she won't go to therapy, then you might start like by suggesting it. And if that person like rejects the idea, then you have the option of stay in that relationship or leave them. But
Okay,
you can't like you can't force anybody to go to therapy.
because it won't work, I guess.
Most of the times it's not like a general rule, but most of the times it won't.
Okay. Yeah, I remember when I was really young, and our mom, decided that I should go to see a therapist, but they never really explained to me why I was going there. They just sat me in front of this man that I didn't even know what he was trying to treat or like fix. So I was completely closed off to it. I don't think I even went to more than 8 sessions with this guy. And I was like, yeah, I'm done, because I wasn't open to it. When in this other, the next time I looked for a therapist myself, I was completely open to the idea, well, for the most part, and it actually worked. So, okay, this is another question from someone in our community. They're asking, how can someone stay present in your line of therapy? What's something you would suggest for someone that's looking to be more present? Because they say it seems like we're all distracted and busy these days, and we can't stay present.
Well, they could work with some mindfulness. Yeah, mindfulness is it's a skill that you have to develop, because yeah, that's right. We are like on the daily basis, we are clearly distracted by our phone or social media, by the TV, and we're doing everything, and at the same time we're doing nothing because our mind is always somewhere else. So just to try to stay focused on the present, you can start with some mindfulness exercises, so you can like, it's like a muscle. If you go to the gym, you have to train that muscle.
Yeah. So you have to exercise your mindfulness.
Correct.
Okay. Okay. And another question from our viewers. At what point should you cut someone out of your life?
If someone's not respecting your boundaries, or if this person is not right for you, for the whole bunch of reasons, of different reasons, as I said, you could ask people to respect some boundaries, or to change, or let them know that they're hurting you, or that something in the relationship is not working correctly. And if this person is not open to change, then perhaps you should cut them out of your life. For example, it might happen for someone who has an addiction, and he gets high, or whatever substance they're dealing with some friends, and this person decides to quit. But every time that he sees his friends, the friends like try to pursue him to consume this substance. And the first time he'll say like, man, I'm trying to stay clean, please don't offer me this, or let's do something else. But if the friends or these other people won't respect the boundaries, perhaps the patient needs to realize that it's time to let these people go.
Yeah, you can always try to set a boundary, and that might work, but once they don't respect that boundary that you've clearly said, I think it is time to cut them out of your life. And how do you suggest someone may go around doing this, like just completely just cut them out, cut all of communication? Or is there a way to just do it, how can I say, like not halfway, but little by little?
I think it depends if your well-being is on jeopardy, and that you have to be like really conscious about your objectives in life. If your mental health or your well-being is on jeopardy, then you just have to consider just cutting them out.
Okay.
Well, this is like difficult for some people, because we tend to mix the fact that we love someone, and how many times have you heard like, he hurts me, but he's my dad, I can't cut him out of my life because he's my dad. Well, yeah, but the thing here is that you as an adult looking for your well-being, need to understand that you can love someone, and at the same time this someone might also be hurting you, so you might as well just take a step back and love them
from a distance.
Yeah.
You can love them without compromising your well-being.
Correct. So one thing doesn't necessarily exclude the other one.
Yeah.
That two of them might be right, and true at the same time.
And I guess sometimes one can help the other in the sense that once you take a step back, that other person might realize what they were doing, and then you can start working on rebuilding the relationship.
Yeah, it might happen, but it might not. So
Okay.
don't expect it to happen, because then if it doesn't, then you just like end up in like vicious circle.
Okay. Okay. And just, well, I have just two questions for you. The first one would be, why did you decide to become a therapist? And the second one, and maybe they're complementing each other, that's why I'm going to ask them together. What's your favorite part about being a therapist?
Okay. This is complicated, but in the trying to make like a summary, I think that I chose to be a psychologist because as I grew up, I had some psychology models that I look up to. And also because, as I said before, I experienced some stuff as I grew up, and I decided to take psychology as my personal work tool.
Okay.
Okay, so to deal with myself and to come forward in life.
Okay.
So that might be one of many reasons why I study psychology. And what was the second question?
What's your favorite part about being a psychologist?
It might sound as a cliche, but helping others. It's really fulfilling when I discharge someone and I can see that it's a whole different person that came into the practice and that they're doing so good in their life. It's really fulfilling.
I think it's one of my, I say, frustrated career paths. That's why I like to go, because I really do think it's really interesting and, like you said, very fulfilling to help people like that. So thank you for doing what you do. And thank you so much for being here today and answering all of these questions. I'm sure a lot of people are going to find your answers really, really interesting. And now you know, guys, if you are looking for a therapist, there are tons of types of therapists you can try, and just don't give up. Keep looking until you find the right one for you.
Thank you for having me.
I'll see you soon. Bye.
Bye.
So, as you can tell, there are many types of therapy, and there are many styles of therapists, and there is no right or wrong, just what works for you and what doesn't. So, I really hope this conversation helps you to get a better idea on where to start your therapy journey. And if you have any other questions about therapy or any other topic that you want us to talk about, just post it in the comments or email us, and we'll make sure to answer them. And I'll see you on the next episode. Bye.